Again, when we think of tongue ties, we think of things that we can see, right? So if somebody showed up, I mean, this is an infant, but if somebody showed up in your studio on the left, you would be like, "Oh yeah, you have a tongue tie," right? That one's nice and easy. What about this person on the right? If you saw them as your student, would you think that they have a tongue tie? Because they absolutely do, but he's a little bit more hidden, should we say? Well, there's actually some that you cannot see at all. We hidden tongue ties or ones that don't show any sign. They tend to be very common in mid tongue and posterior restrictions. They look like this. So, that little middle line of his tongue, it's pretty pink, right? We don't look at that and say, oh my gosh, you have a lisp, you have this, you can't eat, whatever. No, that looks totally normal, right? And like, yeah, his tongue looks a little bit short and a little bit wide, but it doesn't look like there's really any issue there, right? He's able to lift it. It looks like he's getting a fair amount of function. Okay, well, let's give him a frenectomy and see what happens. Okay, so now we're seeing that his function is completely doubled, right? Now he's closing off that entire space at the roof of his mouth, and the mid portion and the back of the tongue is also lifting, right? So we can see afterwards how much range of motion and function this person is having from their frenectomy because it's totally different from where we started, right? So I just want to reiterate that these aren't things that we can just look at and see. We have to address them functionally. That is, we have to see them move and watch their strength to see if they have something that we might not be able to see. So let's talk about this a little bit more anatomically. So if we have a tie that's fairly short and it's located right at the base of the tongue, it seems pretty harmless, right? Oh, it's just short, it's at the bottom, it's not really affecting anything, right? Wrong, because what this is going to do is it's going to affect the entire posterior section of your tongue, which, is kind of important for singers, right? Just a little bit. So that entire section is going to be either restricted movement or in some extreme cases might not have any movement or isolation at all. Now, if the tie extends up even further, well, now it's going to restrict that entire back portion and the mid portion of the tongue. So now we're not able to lift the back or the middle. And then if it extends all the way to the tip, well, guess what? Your entire tongue is not going to function and move the way that it should freely. So again, there's varying degrees. You can have a really tight frenum or you can have a more loose one. But what I want to demonstrate is that any sort of tie is still going to restrict you. It doesn't matter where it is. It doesn't matter how long it is. You're going to have a lot of compensations and bad results from those. So let's go into that a little bit deeper. Let's say that you have a short tight frenum that's causing a posterior restriction. Basically, that's going to prohibit you from correct tongue posture, right? Because you're not going to be able to lift that back section of your tongue up on your hard and soft palate. You're also not going to be able to swallow correctly. A correct swallow requires a correct tongue posture. And then you're not going to be able to elevate that portion of the tongue. And you're also, drum roll, not going to be able to get an elevation of the soft palate because, as we may know, the palatoglossus is connected to the back of the tongue, right? So if you want to lift it, you have to lift the back of your tongue. Well, if you can't lift the back of your tongue, guess what? Your soft palate isn't going anywhere, right? So you may be able to lift it a little bit if your frenum is a little bit looser, but you're still not going to be able to lift it as much as you could as if you were totally free, right? And also, really important, if you can't elevate the tongue without any laryngeal or jaw motion, because you're going to be tied into that predetermined position. So, If you go to, let's say, sing an E vowel, and you attempt to stretch and elevate the back of the tongue upwards, you're not going to be able to do that because of your tie. So what happens is now that whole portion becomes a predetermined set of space. So you have to choose between lifting your tongue or keeping your larynx low. So I use a metaphor like an elevator, right? So if you go to lift the back portion of your tongue, guess what? Your larynx is going to come with it and your jaw. Okay, well, if you want to keep a low larynx and a nice open jaw, let's say you're singing a high note, right? You need a lot of space. Well, guess what? That tongue is not going to lift. It's not going anywhere, right? So now you're stuck between a rock and a hard place. You have to choose. Do I want a high tongue with a lot of jaw tension, or do I want a nice low relaxed larynx, but I have to sing everything on an O vowel? That's not really going to work out so well. So here's some of the things that I see and hear with singers that have a posterior restriction. This is just general. They really, really struggle with E and E vowels because that requires a really high back of the tongue. They also cannot do NGs, especially if they're going to ascend in the top section of their voice, right? They have a lot of trouble with high note phonation. Like I just described, that elevator is really going to restrict you, right? Um, and they also tend to use or prefer a lot of open vowels, right? Because all of those open vowels, you can more or less allow that tongue to just lay there like a carpet, and that gives them a release of tension that they're looking for. So I want us all to do a little experiment real quick. We're going to take 2 or 3 fingers and put them on your jaw, and I want you to open as wide as you can, gently. And then I want you to make an NG noise without moving your jaw. Mm, mm, right? A lot of you might not be able to do that. Now, if you can, let's take it one step further. Let's go back into that same position. You should be able to sing an entire siren to the entire top of your range and back down without having to move your jaw. Mm. Yes? And if you're feeling like something's happening down there, what you're experiencing is that elevator, that fight against lift. Yes? All right. Well, let's say that it extends past, right? So now let's say your freedom is a little bit longer and it goes into the mid tongue, right? So now it's going to affect this entire mid portion. So again, you're not going to be able to get good tongue posture. You're not going to be able to get a correct swallow. But now you're also not going to be able to elevate the middle of the tongue. I also see a lot of clients that have trouble extending the tongue out of the mouth. Paula, I think that was you, right? And you're not going to be able to get that elevation of the mid tongue separate again from the jaw and larynx. I notice it especially in the jaw with my clients. Um, Singers with these tend to struggle with these vowels and these sounds, especially that nya 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 nya, because it's just that middle portion of the tongue, right? I also notice that these singers tend to bottom out in their lower range, especially if they've been singing for a long amount of time. And what they're experiencing is as they try to lift, that mid portion is tugging on their larynx and it's fatiguing them. Um, they also tend to struggle with their bottom of their passaggio because that's when we really need a lot of that mask resonance, right? That's when we really have to drive everything forward. So we want the back of the tongue and the mid part of the tongue forward. And that's when they really, really struggle to get into that mask placement. So not only do you have all of that, but guess what? You also have all of the posterior symptoms. Oh no. Oh no. Right? Okay, well, I'm sorry, but it doesn't end there because let's say that your freedom goes all the way to the tip of your tongue. So now your entire tongue is not able to function correctly. So guess what? You're not going to have good tongue posture. You're not going to have a correct swallow. And also you're going to have little to no tongue mobility, strength, or isolation. Your articulation is certainly going to suffer, right? And again, you're going to have a lot of issues. Tongue tip clients have a lot of issues with jaw tension, and they tend to have a lot of stress in the front part of their necks, whereas mid and posterior tend to have stress in the back of their necks. You'll see these people have a lot of stress in the front. They struggle with all of these sounds, right? Everything that requires that tip lift, L's, D's, T's, and even S's, right? Now, they may be, I'm not saying that you're automatically going to have a lisp. What I'm saying is that, let's say that you're a baritone and you're singing a patter aria and you just cannot get all of those consonants at a fast tempo. Well, maybe we should see what's under your tongue, right? Maybe you're having a restriction that's allowing you to flutter really quickly, right? I also find that these people have trouble really funneling and focusing the sound, especially on closed vowels in the middle voice or the lower middle voice when we want to be really, really nice and forward on our teeth. Also, almost that like musical theater brassy sound, they have a lot of trouble with that. And guess what? That's including all of the mid-tongue issues and all of the posterior restriction issues, right? So this is like a huge deal. So, a couple of not so fun facts. If you're sitting there thinking to yourself, oh my God, I'm gonna die, I have a tongue tie. I just want you to say, it's okay. Just take a little breather. You're not alone. I had a tongue tie. Julia had a tongue tie. Leah had a tongue tie. In fact, 75% of all adults have some sort of tongue tie, right? And of those 75%, 45 have moderate to severe. 45. This is an epidemic, people, especially amongst singers. If we want to be able to create a really fabulous environment for ourselves and a starting position, freedom, ease, that's what we crave, right? We have to make sure that we're anatomically starting with a clean slate. So, just with a frenectomy and orofacial myology, we can completely cure all of that poor tongue function, strength, and posture. So this is very easily changed. You're not going to like ruin the rest of your life, right? This is a really quick fix. And not only is it going to help your singing, but it also can help your sleep, your eating habits, right? Your breathing habits, your exercise habits, your body pain. So the moment we've all been waiting for. Let's do an exercise to see if you could be tongue-tied. I'm going to give you two. We're going to test your tip and mid portion restriction first. And if you pass that test, then we're going to test for your posterior restriction. So we're going to take the tip of our tongue and we're going to place it right behind our top two teeth like this. And then I want you to gently open your mouth as far as you can without moving the tip of your tongue from that spot. It should look like this. Now, holding that position, you should be able to fit 3 whole fingers between your teeth with ease, like so. If you have 2.5 or 2 or even 1, guess what? That tie is all the way up into at least the middle, if not the tip of your tongue, and it's restricting that upper movement. So if you all would like to share, can you just write in the chat real quick, how many of you failed that test? Now, for all of you who did pass the test, well, you passed one of them. We're going to do another one for a second. I'm trying to get my chat back up. 1 second.
Jessica,
yep.
I want to bring up an important point. Somebody just said, what if my tongue is short? Can we talk about the short tongue thing a little bit?
Short. If my tongue is short.
I think what is inferred is that the reason why you can't open is because the tongue is short. Or at least that's the thought behind it.
Well, I think that you probably have one of those hidden ties, right? I mean, everyone's tongue is shaped a little bit differently, but the point of these exercises is that everyone should be able to do them, right? This isn't like gym class where some people are better runners than other. No, this is baseline function. If you cannot do that exercise and get 3 fingers, you I mean, it's not a shape issue, it's a function issue. You are restricted, right? So my tongue, for example, is wider than most people's and it's a little bit larger, but I'm still able to fit through that exercise. All of us should be able to. I hope that answers your question. Failed. 2.75. Is that a tongue tie? Well, Susan, we're going to find out. I'll let you scrape by into the second exercise because I'm curious to see if you pass the second one.
Now,
So, can barely
Jessica,
get. Mhm.
I just want to point out, Sarah actually, we know Sarah has a tongue tie, and Sarah says she could pass the test though. So is there a little bit something that, Sarah, I think you have a posterior tie, is that correct? I forget what the actual diagnosis was, but if you want to come unmute yourself and you don't
Yes,
have to, but, oh, yes, yes.
yes,
There you go.
I have a tongue tie, a posterior tongue tie.
Yeah.
And so that I can, if I keep the floor of the mouth down, then I cannot touch the upper teeth at all.
Mhm. Well, like I said, everybody who passed this test, you only passed the first round. We're going to do another one real quick. So I'm curious to see if you pass this second one, because now we're going to test our posterior restriction, right? So I'm going to have us do the one that I just showed you, that NG noise. So you're going to take 3 fingers, you're going to rest them gently on your chin. You're going to open as far as you can. Now from there, you should be able to make an NG noise without moving your jaw at all. Mm. You should have absolutely no tension here and no tension here. Mm, nga, 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 nga. Right? How many people failed that test? Pass, pass, pass. Nice. Uncomfortable. If it's uncomfortable, then guess what? You're getting that elevator involvement, right? Uh-huh. If you can do this one and not the first one, then that means that you have a frontal restriction, right? Uh-huh. All right. Let's go back to our, sorry. Oh, if you can't open the jaw all the way without tension, then you have TMJ. Right? Temporal mandibular joint, right? That's tension here. Uh-huh. If you can't roll your R's, that might be a tongue tie and a strength issue. Angela, you might have to see which one of those tongue tie passes you passed, right? All right, let's do another tongue posture exercise. I'm going to teach you the cave hold. Anyone who has ever done orofacial myology knows the infamous cave hold. So basically what we're doing is we're just recreating what correct tongue posture feels like. So for the sake of simplicity, this isn't exactly correct, but it'll be a little bit faster. I want you to take the tip of your tongue and to rest it on your dental ridge, the back of your dental ridge on your gum. It should not be touching your top front teeth. It should be just behind there. And then I want you to lay the entire top portion of your tongue up against your hard palate and soft palate. So it should look like this. You can see how I have space all the way to the back of my tongue, all the way back by my molars. Yeah. Now, if you hold that position, again, you should be able to get 3 fingers from that position. right? How many of you? Nope. Yeah. Nope. Here they all come. Nope, nope,
You know
nope,
what's
nope.
funny, Jessica? On this one, I noticed on this one, Jessica, that the first one, like I could fit 3 fingers, but on this one I can fit like them in even more. So I
Oh,
wonder if
nice.
some people have that experience as well.
It's not comfortable, right? You can just do it. Okay, so if you can just do it, that's your body's already starting to incorporate some of that compensation, right? So you might have one of those ties that's a little more lax, like a bungee cord as opposed to a rope. But what's happening is that your whole neck goes like this, right? So that's not freedom and ease, right? That's compensation. Please demo again. Okay, yes, sorry. I have a cramp. Aha, if you have a cramp, that means that your muscles are not used to being up there, right? Just like when you get a cramp at the gym, it's like, oh, what is this? Not sure if the whole tongue is on the roof. Okay, we can do this exercise again where you stick it out and you just tap it, or you can tap your soft palate so you get a little bit of kinesthetic feedback to see if you are touching that spot. It might help you to swallow into that position. Got a cramp? Yeah. Only 2. Okay, so that's not bad, Diana, right? But ideally we want 3, right? Last one was the worst. Yeah. Okay, so some of us passed. No way, my neck is crazy tight. Okay, Maria, you said I passed the other ones, but not this one. Okay, so what is that telling us, right? That's telling us that you don't have the tip tie and you don't have the midline restriction, but that you are getting a posterior restriction, right? Like that first little diagram I showed, just right here at the base. Uh-huh, fabulous. Thank you all so much for that. Yes, Cecilia, you do need a slight suction to do this. Uh-huh. Even short people should be able to do that. Yes. Yes, because your tongue is still uh what's that mathematical term? Oh my gosh. It's still to scale, right? Our bodies are still to scale, right? So just because you have a bigger face doesn't mean that you should be able to do them, right? Everyone should be able to pass all of these tests.